I'm Caitlin Campbell. This summer I've had the opportunity to work at APCI, that's the American Pharmacy Incorporated in Bessemer, Alabama. What they do is they work as a buying group for around 700 independent pharmacies over 17 different states. Through this experience I've had the opportunity to see revenue building opportunities and kind of see what that would look like when applied to an actual independent pharmacy. That being said, none of this information or numbers are beliefs or true numbers from the APCI. This is simply fictitious numbers set up really to demonstrate the economic scenarios that we found within this last semester. So chronic care management revenue options. And we'll delve into what those are. I know everyone is sick and tired of healthcare and I am so sorry, but we'll make this as simple and easy as possible. So local pharmacy is the independent pharmacy we'll be looking at today. What their staffing typically looks like is 2 full-time pharmacists, 2 full-time technicians, 1 part-time technician, and then a front of store manager. And we'll get into why that matters, as well as what their wages look like. So they have 150 to 250 patients a day. And that's actually about a quarter of what you'd see in a typical chain such as CVS or Walgreens. But it is enough patients to sustain a livelihood for these smaller independent pharmacies. And they are a member of the APCI, and that is allowing them the opportunity to play a role in this pilot program that we're going to discuss. So the traditional livelihood is actually made off of front of store sales. So that's more the things you would see in a front of store for Walgreens or CVS. So the candies, the hair conditioners, the supplies that are kind of scattered out there. And the reason that's happening is because reimbursement rates on medications are very quickly dwindling, as Medicare, Medicaid, as well as third-party providers are reimbursing pharmacies less and less for the medications they provide. So who's making this decision? Well, the pharmacist and owner of local pharmacy would be making this decision. He should have the information necessary to make an educated decision, and then at the end of this, I'll kind of tell you my recommendation on what I think he should do. So what is the proposition? So chronic care management is essentially Medicare members only. So it's only provided to those who are eligible for Medicare, and I would go into that, but again, healthcare, just know most of them are over the age of 65. So it's a 20-minute non-face-to-face services each month. So that's phone call, conversations with healthcare providers, or really just looking at the medications on the computer, making sure everything lines up, there's no interactions or no potential for harm in the future. And so the hope of Medicare is that by investing in these services, they're going to be able to reduce healthcare costs in the future for these patients. The thing is they have to have 2 chronic disease states. So that's asthma, COPD, autism, heart failure, hypertension, and those have to last a year or until death. And most times when you see 1, you're going to see 2 or more. And so the software provided, so that is necessary to have the electronic health medical records. And so that's something that you'll see in any hospital, but it's something that's kind of new to the pharmacy. So that's what Critical Key, or the company, is providing APCI. So Critical Key is the company providing the electronic health medical record to run the chronic care management sessions. Okay, so what does the market look like? Well, the market size is fairly large. There's about 35 million eligible in the United States alone, and that's 80 to 85% of each physician's office's patients. So physician's offices, and this is the healthcare world again, the way this program works is that you have to bill, as a pharmacy, you have to bill through a physician's office. So the physician's office doesn't do essentially anything but provide patients, and they get reimbursed at a higher rate than the pharmacy that's actually providing the clinical service. So around 80 to 85% of a physician's patient population is huge. So physicians are going to be more willing to partner with these pharmacies. So the market competition, well, that being said, physicians' offices can also partner with multiple pharmacies, but what we've seen is that the 3 things that really draw patients to a pharmacy are services provided, their relationship with their pharmacist, and the location of the pharmacy. So these chronic care management sessions wouldn't necessarily be a drawing factor for new patients coming to these pharmacies. So market competition. 3 other pharmacies are currently involved, and then 10 is the hopeful goal of how many will be in the pilot program by the time it's all said and done. So market competition right now is at a low, but as I previously said, they're not necessarily competing over these services, and these services won't provide new members at this point in time, unless Medicare were to enforce new laws in the future, and that's going so far into healthcare that I know no one wants to hear. So that being said, market competition is at a low, It will obviously increase if this proves to be beneficial, but the barriers to entry are also extremely low. Once you partner with chronic care or with Critical Key for the chronic care management, you have full access to everything as long as you can partner with a physician's office. The barrier is simply that electronic health medical record, and that could be purchased through another provider outside of Critical Key. So the numbers. Here's where we get into the economic impact, how we decided this is revenue efficient for this pharmacy. So the software that we would purchase through Critical Key is $299 a month. The training cost, and so this would just be an initial fee, and after that first month, it'd be sunk cost. We could either pay $100 for a webinar, $500 for in-person training, so that would be we would go somewhere and they would train us in person, or $700 for an in-pharmacy training, so they would come to our pharmacy and train us personally. So what I've decided is that the $100 webinar is sufficient for all information we'll need to know. It's actually just a video of training that has already been done in person, and you're able to type in questions and get those answered fairly quickly. So we're going to go with $100 for the webinar to reduce our cost, and then we're looking at the reimbursement. So the reimbursement here is the price, and that's set by Medicare and is non-negotiable. So physicians actually receive $27 a session, while the pharmacy receives $15. And this is what I was talking with Incident 2 billing. So the physician is actually receiving a lot more than the pharmacy, and the physician is only providing patients and doing that of the work. So who should be providing these services? So we've decided we're going to do it in the pharmacy, then who within the pharmacy? So this goes back to our staffing. We have pharmacists, we have pharmacy technicians, and then front of store managers. So the front of store manager would be ineligible to provide the service, as well as they have a lot on their plate dealing with the front of store. So then we look at the pharmacist and the technician. So pharmacist pay is around $58 an hour, while the technician's pay is around $12 an hour. So if we see that the pharmacy is only making $45 an hour for reimbursement, then we know it's not beneficial for the pharmacist to be providing these services. So the technician needs to be providing these services, and that's going to form a difference that we'll see later. So what we've talked about in economics this year is moving something of low value to high value. And so in this case, we're taking a technician's hourly wage, which is low value, and turning it into something of higher value, which is $45 an hour, while then providing chronic care management sessions. So the cost of business. So this is kind of the breakdown of what we make each hour based on the technician performing these services. So we said $45 an hour minus their hourly wage is going to be $32 profit an hour. Now each session is only 20 minutes, and so for each session we're actually making around $12 an hour. This also breaks down our fixed cost as well as our variable. So we know fixed cost is the $299 service charge per month, and then the variable cost is going to be dependent on how many chronic care management sessions we're able to do, and then the technician's wage according to each, how long they're working on these sessions. So then we look at the break-even point. So this tells us the point at which we are cutting even or have paid off all of the necessary costs to begin making a profit. So here we see $299 is our fixed cost, and then we have 15, so this is per session, per 20-minute session. 15 minus 4 is going to be 27, or round up, 28 chronic care management sessions per month are necessary for the pharmacy to break even and to begin making a profit. So once you reach that point, then it becomes an extent decision of how many should we do, how much time should be devoted, and it can get a lot more complicated when you start adding in the technician's benefits and other packages as well, if they're starting to do more with chronic care and less with the prescription filling process. The point at which the extent decision should probably stop is the point at which we would have to hire another technician to do these services. So my recommendation. I recommend starting out at 50 chronic care management sessions a month. This is providing an additional $170 in revenue. So a decent starting point for the company. I would reevaluate this extent decision after the first quarter. And so that's where I was talking earlier about when we need to, or how much we need to do in order to make the best profit for us, but not overstep that to the point where we're having to hire new technicians to run these services. So a new program similar to CMS, or chronic care management. What we've seen is that medication therapy reviews, as well as other clinical services like chronic care management, are quickly hitting the market as Medicare realizes they can save money in the future by implementing these services now. So looking forward to that, this would provide much more opportunity and greater gain in the future to implement and to purchase this program now at $299 versus in the future, which is in higher demand, could go up and there could be more barriers to entry. Really have enjoyed this semester with you all. Hope to have it with some of you all again in the future. Thanks.